Antidote for Factor Xa anticoagulants. Expositor Carlos Rodriguez. Instructor Dr. John Moscoso. Definition: an antidote is a way of preventing or acting against something undesirable. Anticoagulants are agents used to prevent the formation of blood clots. Andexanet alpha is the principal antidote for factor Xa anticoagulant. It is a modified recombinant derivative of factor Xa. It acts as a decoy receptor, a classification of competitive inhibition. It upgrades the waterfall of coagulation to reach the hemostasis, and this is the mechanism of action.
Coagulation factor Xa plays a pivotal role in the final common pathway of the coagulation cascade. Factor Xa assembles together with factor Va on the platelet surface, forming the prothrombinase complex, which is responsible for the large-scale conversion of prothrombin to thrombin. Inhibitors of factor Xa work by one of two distinct mechanisms. Small molecule direct factor Xa inhibitors, such as apixaban or rivaroxaban, bind to the active site of factor Xa and neutralize the catalytic activity of the prothrombinase complex. Indirect factor Xa inhibitors, such as enoxaparin or fondaparinux, bind to native antithrombin 3 and potentiate its capacity to inhibit factor Xa. Andexanet, an investigational drug, is a recombinant factor Xa derivative being developed for use as a universal antidote to direct and indirect factor Xa inhibitors. Andexanet lacks the membrane-binding domain of plasma-derived factor X and does not compete against native factor Xa and prothrombinase assembly on the platelet surface. Andexanet also features a serine to alanine substitution in the active site and a deletion of the heavy chain activation peptide that is present in native factor X. Thus, Andexanet lacks pro- or anticoagulant activity on its own. The mechanism of action of Andexanet is based on its capacity to function as a decoy factor Xa molecule. Andexanet binds to direct factor Xa inhibitors with high affinity, sequestering the inhibitor and thus rapidly reducing the free plasma concentration and neutralizing the anticoagulant effect of the inhibitor. Andexanet also binds to and sequesters molecules of antithrombin 3 that are complexed with indirect inhibitor molecules, disrupting the capacity of antithrombin complex to bind to native factor Xa. Currently, there is no effective antidote for reversal of factor Xa inhibitors, especially the direct factor Xa inhibitors, the uptake of which is increasing.
Application in medicine. Andexanet alpha is an antidote for factor Xa inhibitors, a group of anticoagulant drugs that include rivaroxaban, apixaban, and edoxaban. They are used to revert in an easy and speedy way the mechanism of Xa anticoagulants during certain situations in which it's indispensable the coagulation, such as bleeding, traumatism, and surgery. Andexanet alpha has a high affinity for the factor Xa inhibitors and competes with native factor Xa to bind the anticoagulants, which frees inhibit factor Xa to assemble into the prothrombinase complex and generate thrombin, therefore promotes coagulation.
Factor Xa inhibitors such as apixaban and rivaroxaban are convenient to take but can cause bleeding complications. Many physicians hesitate to use them because there's no easy way to reverse the effects of treatment in the event of an accident, internal bleeding, or a surgical emergency. Andexanet is a fragment of factor Xa that was designed to rapidly reverse the anticoagulant effects of these inhibitors by preventing their binding to authentic factor Xa. To test the efficacy of Andexanet, a small phase 3 trial was designed with healthy older volunteers as the participants. They were given either 10 milligrams of apixaban or 20 milligrams of rivaroxaban daily until steady-state anticoagulation had been achieved. Then intravenous Andexanet was given to determine whether the effects of these anticoagulants on blood clotting could be reversed, and if so, what the side effects might be. The primary outcome was the mean percent change in anti-factor Xa activity, which was significantly reduced both in participants who received a bolus of Andexanet and in those who received a bolus followed by an infusion of the drug. Participants who received a bolus of Andexanet had fully restored thrombin generation within 2 to 5 minutes, and this effect was sustained while Andexanet was given as an infusion after the bolus. No serious adverse events were noted. The authors conclude that Andexanet reversed the anticoagulant activity of apixaban and rivaroxaban in healthy older volunteers within minutes and for the duration of infusion, without evidence of clinical toxicity. Full trial results are available at nejm.org.
Issue applied in Ecuador. Andexanet Alpha, Statistics and Publications about a Global Point of View.
Andexanet alpha produces reliable reversal of the anti-factor Xa effect of all of the Xa inhibitors, and this has been shown in numerous publications at conferences over the last 2 or 3 years. Essentially, to summarize all of the results, when you give an appropriate dose of Andexanet alpha, you produce a proportionate reduction in the levels of anti-factor Xa of any of the agents. The effect is immediate at the end of the infusion and lasts for a period of about an hour or so. The drug has a short half-life, and then the drug returns to its anticipated level. You can prevent this recrudescence of the anti-10A effect by giving an infusion at the time of the bolus. And you can see from this slide that, for example, with rivaroxaban, there's a dose-dependent reduction in the 10A inhibition as you increase the dose of the Andexanet alpha. There's a large clinical development program, and the first of the studies that is probably going to lead to licensure of this product is called ANNEXA-R. It's divided into 2 parts. Part 1 is a bolus infusion of rivaroxaban. The primary endpoint is a surrogate, the percent change in anti-factor Xa activity from baseline to nadir in patients who are dosed to steady state and then receive a dose of the Andexanet alpha. The secondary endpoints are the occurrence of an 80% or greater reduction in anti-factor Xa levels, the change in free rivaroxaban concentrations, changes in thrombin generation, and the occurrence of thrombin generation above the lower limit of the derived normal range. So in this slide, again, we see that when Andexanet alpha is administered to patients who've been dosed to steady state with rivaroxaban, we get excellent reversal of the anti-factor Xa effect of the rivaroxaban. And as a note, in previous phase 2 and phase 1 studies, we've seen identical results with apixaban and with other 10A inhibitors.
This is a poll made in Quito, in which 92% of the cardiologists that was in the survey prescribed oral anticoagulant, in which the most common drug for anticoagulants is rivaroxaban, with a rate of 57%, showing how matter it is to find the right antidote to reverse these anticoagulants. Pros and cons of Andexanet alpha. Disadvantage of Andexanet. There is the side effects that are thrombotic events and deaths that were reported during the clinical trial. A controlled trial is needed to assess whether rates of these events are higher than expected for a population that had inherently high risk for thrombotic events. This is expensive and a constant treatment, and further data are still necessary to assess adverse outcomes in at-risk populations. They also develop low-titer, non-neutralizing antibodies to Andexanet alpha, making a resistance. Advantage related to Andexanet alpha. It is an universal antidote for both direct and indirect factor Xa inhibitors. It is rational designed by bioengineered factor Xa decoy. It has the potential to serve as a safe and effective antidote for DOAC-related bleeding. Early clinical study has been reassuring about prothrombotic property and immunogenicity. It restores the ability of native factor Xa to assemble on phospholipid membranes and form the protein-binase complex. It reduces anti-factor Xa activity by at least 80% and achieves excellent or good hemostasis in most patients with life-threatening bleeding. It also developed low-titer non-neutralizing antibodies to andexanet alpha, but these are short-lived and become undetectable within 15 to 30 days.
So just a few words about emerging antidotes. So again, andexanet alpha is the very specific antidote for the 10A inhibitors. It's a modified factor 10A, which works essentially as a decoy. It binds to and removes the 10A inhibitor from the circulation with very high affinity. In clinical trials that have been done so far, it's been administered to a substantial number of healthy volunteers, and some patients who are actively bleeding, it's had really no significant adverse effects. We haven't seen any evidence of thrombosis, although when it's administered to patients with no anti-10A inhibitor on board, there is some evidence of activation of coagulation, which may be beneficial in an actively bleeding patient. It produces short-term reversal after an intravenous bolus, and you can administer an infusion to produce long-term reversal. And there's trials going on now, a large clinical trial, which is enrolling patients treated with rivaroxaban and apixaban, and we anticipate shortly being able to add other 10A inhibitors to the eligible medications.
Conclusion. The drug has presented great advantage in the field of medicine. Pharmaceuticals spoke that andexanet have a great safety margin in therapy. Furthermore, there are huge expectations regarding the improvement of anticoagulant treatment by having a speedy and safe antidote. Even so, as all drugs, it must continue to be analyzed and keep track of side effects that may arise in the population. According to this consideration, it is a wonderful recurrence that allows treatment with anticoagulants being even more effective. Concluding consideration of andexanet alpha.
In this study, we demonstrate the part 1 of the ANNEXA-R study that we met our primary endpoint of a reduction in the anti-factor 10A level. In this slide, interestingly enough, we would have had 100% reversal, except one patient probably didn't receive any andexanet because of a malfunction of their IV. The secondary endpoint was having more than 80% reduction in the anti-factor 10A level, and there were highly statistically significant differences between the placebo and the andexanet group. And this, again, is very consistent with results in the many previous publications, abstracts that we have in this area. There were a number of other endpoints in this study, all of which were also successful. So, for example, we identified a dramatic and predictable reduction in free rivaroxaban, and in addition, we demonstrated that thrombin generation returned rapidly into the reference interval and much more quickly with the administration of andexanet alpha than was seen with the administration of placebo. So there's no doubt that with the new anticoagulant agents, we've really entered a new era in anticoagulant therapy. Much greater choice, probably easier to use than warfarin, probably safer than warfarin in many patients. Problem, of course, is that we don't have a reversal agent. It's been identified that there's a need for a reversal agent. We look forward to having reversal agents available to us, reversal agents that are able to ameliorate bleeding complications in really sick patients taking these anticoagulants. There's a lot of active research in this domain, publications almost every month, certainly every major scientific congress. An exciting area to be working in. We look forward to additional information.